Good afternoon, everyone, and welcome to our first virtual health talk. We're excited to be back and trying this new online format after many months. My name is Melissa, and on behalf of the Patient Education and Engagement Program at the University Health Network, I would like to thank you for attending today's session called Virtual Visits, Making the Most of Your Phone or Video Appointments. I would like to first take a minute to thank our planning team, first the Patient Education and Engagement Program, the Patient Learning and Experience Center staff, and Education, Technology, and Media Services. So just a quick few words about our new online format. This session is being recorded and will be available for viewing at this same YouTube link afterwards. Today we'll have a presentation for approximately 35 minutes, followed by a question and answer period. So to submit your questions, we invite you to go to the link on your screen. Go to slido.com and enter UHN Health Talk in the event code. You can also scan the code using your smartphone's camera or QR code reader app. You can submit questions anytime during the presentation, but just a few things to keep in mind before you submit are, you can choose to include your name or stay anonymous, but please note that others will be able to see your name if you do include it. Please do not include any personal details about your health condition in your question. Our health talks are for general health information only. The speakers are not here to diagnose or provide treatment recommendations, and we'll try our best to answer as many questions as we can during the question and answer period. And lastly, you can also vote for your favorite questions by clicking the thumbs up button next to the question, and this will help bring the questions closer to the top and they'll more likely be answered. And if you have any questions about the live stream during the session, you can email us at pfep@uhm.ca or leave a voicemail at 416-603-6290, and a member of our team will get back to you shortly. So to begin, moving on to our presenters. Today we have Arjun Vora, who is our patient guest speaker. He is an account executive at Procter & Gamble. He arrived in Canada 4 years ago to complete his Master of Business Administration at the University of Toronto. He got married in January 2020 and now lives with his wife in the Greater Toronto area. Next, we have Sucheta Heble, who is a speech-language pathologist and has worked with individuals with acquired brain injury at the University Health Network's Toronto Rehab for the past 20 years. She has presented at local and international conferences and as a lecturer at the Department of Speech-Language Pathology at the University of Toronto. She has enjoyed her role as a clinician, clinical educator, lecturer, and group facilitator, offering virtual mindfulness groups for the Tele-Rehab Center for ABI. She continues to provide virtual speech therapy sessions to her outpatients in the Neuro Rehab Day Hospital program at Toronto Rehab. Next, we have Jacqueline Davies, who's a graduate of the Masters of Clinical Science in Occupational Therapy program at the University of Western Ontario. Jacqueline has spent the majority of her career working with a neurological population in the Neuro Rehab Day Hospital program at Toronto Rehab and has been a facilitator in the Tele-Rehab Center for ABI. Most recently, she transitioned the majority of her practice to virtual care during the COVID pandemic.
Thank you, Melissa. Happy to be here.
Thanks, Jacqueline. And finally, we have Karen Sasaki, who is a social worker at Toronto Rehab and adjunct lecturer with the Factor Inwintosh Faculty of Social Work at the University of Toronto. For more than 25 years, she has worked in the field of neurorehabilitation with adult survivors of brain injury, their families, and community service providers. She has extensive experience providing virtual care through her outpatient practice and through the Tele-Rehab Center for ABI.
Hello, everyone. Thanks for tuning in.
Thanks, Karen. So now we have a great group.
Oh. Sorry. Thanks, everyone. Happy to be here.
We have a great group of presenters today, so let's turn it over to Arjun, who will be starting us off.
Awesome. Thank you so much, Melissa. Hi, everyone. Just to give you a brief introduction, I'll just start off by telling you what happened to me and why I ended up in UHN and got introduced to these awesome therapists. And then I'll just quickly go through some of the strategy and tips that really helped me in managing my appointments and helping me for speedy recovery. And I'll talk about what went well, what are my challenges, and then any other resources that I found was super helpful throughout my virtual therapy. So firstly, on April 2nd, 2020, I had a brain aneurysm rupture. I was taken to Sunnybrook Hospital. I was there for almost 3 weeks. And after that, I was brought to UHN for physical therapy. I was in UHN for more than 2 weeks. I received occupational therapy, speech therapy, physiotherapy, and then I was discharged from UHN approximately early May. And then I was brought into virtual therapy with the team. So just speaking about virtual therapy, what really helped was I was super clear and upfront with the therapist on my objectives. For me, it was returning back to work and getting to start driving my car as soon as possible. I think it's super important that you be very clear about your objectives from day one. And because then the therapists know exactly what you're aiming for and they'll know exactly what to do to take forward. The next thing that really helped me was during my connects with everyone, I used to take notes. Like my laptop was open and any kind of feedback that the therapist gave me, I took it, wrote it down so that I knew exactly before my next connect with them, what I had to work on and what were my homeworks. Speaking about homeworks, highly recommend doing them regularly. Some of them were challenging, some of them were fun. For example, doing tasks on Lumosity, watching TED Talks, were some of my homeworks given by Sucheta, Jacqueline. And yeah, I really enjoyed them. And it really helped me recover for sure. And last but not the least, something super important that took me time to think about was if you have any co-residents or family or friends that you're regularly speaking to or meeting, get feedback from them. Just to share my personal experience, my wife, she initially saw me the way I was recovering and she told me like, Arjun, you are not helping around the home the way you used to. And her honesty and feedback really helped me understand, okay, I need to stop feeling sorry for myself and like get up and help her out as much as I can. What really went well throughout the virtual therapy was that therapists listened to my objectives and gave me the right trainings and activities that I needed to achieve those objectives. It was seamless. I didn't have any connection issues. Everybody was super punctual with every therapy session that I had. And every time I finished the homeworks, I really gained some confidence in myself to be able to get back to work and get back to my normal life. Some of the challenges that I could share is that initially it was super difficult to get organized because I was speaking to 3 therapists at the same time. So I literally opened my laptop, made a folder for each one, and any kind of material that they would send, I would just save it in the respective folders, which helped me track everything. I did feel impatient and frustrated that it would take time for me to recover, which like now in hindsight makes sense why it was the case. But I would recommend everyone just be patient. The therapists know what they're doing and their strategies and recommendations will definitely help your recovery. Some of the resources that helped me manage my conditions or my appointments was one, having a laptop. For me, being organized is really helpful because then I can take my notes, I can like save my homeworks. Family and friends, I cannot stress enough about the importance they have in giving feedback on your behaviors and the way you conduct yourself. And definitely the therapists and their recommendations, without that, I would not be recovering right now and not be the place where I am. And finally, to just conclude, I would recommend virtual therapy. It's my only therapy that I've gone through. And I'm not really, so I don't know what in-person therapy would be like, but I found the whole virtual experience very seamless, very smooth. And I would highly recommend to any patient that, if you want to recover, the therapists are there just to guide you. But at the end of the day, you have to work and take the lead in your recovery. So highly recommended for anyone who's recovering or needs any kind of virtual therapy. Thank you, Melissa.
Thank you, Arjun, so much for sharing your perspective, your story. Really helpful to hear your perspective. So hi everyone, my name is Sucheta Heble and I'm a speech language pathologist at Toronto Rehab. Since this pandemic, my colleagues and I shifted to providing our therapy to our patients completely virtually, and this was a steep learning curve for us early on. But we soon found some benefits to this process, and we're excited to share some of our learnings with you all today. So here's what we'll focus on during this presentation. Firstly, you'll learn more about what is a virtual visit and about some benefits for having medical or other health-related appointments conducted remotely. We'll also discuss some ways to get the most out of your virtual appointments. We'll then highlight when in-person visits are warranted over virtual visits. Finally, we'll leave you with some resources to help you learn more about virtual visits. Next slide, please. So let's discuss what we mean when we talk about virtual visits. A virtual visit or virtual care refers to a healthcare appointment that takes place between a healthcare provider and a patient with a health issue. The healthcare provider could be a physician or a therapist. This session takes place with each person in a different location, for example, your own home or a medical clinic. It allows you to meet remotely with your health provider in real time to discuss your health conditions or concerns. This can occur via telephone or video conference and uses a secure and private video conferencing technology. You can attend your health appointments via computer, a smartphone, or a tablet. Next slide, please. So there are many benefits to having your medical and healthcare appointments done in this manner. You can easily access care when and where you most need it. This can be especially helpful for those living in more remote or underserved areas. Convenience. Many of our patients and clients find it difficult to get to their medical therapy appointments dealing with things like traffic or parking and the unfamiliarity of busy hospitals and medical clinics. Some patients may find it challenging to fit their medical appointments into their busy schedules. Engaging in virtual visits can reduce travel time and expense, especially for people with chronic health conditions or mobility issues. Less stress. We know that attending medical appointments can certainly be stressful. By having appointments scheduled virtually, patients may feel less stressed with their medical appointments. Patients can be at home or in their own comfortable environment with few distractions. This may allow for a more focused and clearer discussion about their health concerns. Virtual health appointments may lead to fewer scheduling changes or challenges for the patient and the practitioner. If you don't have to travel to a medical appointment, you may find less time missed at work or with other personal responsibilities. It can be a relatively quick appointment, and you can perhaps request appointment timings that best suit you. Next, it's often important and helpful for family members to join your medical appointments. Just as Arjun had said, the importance and value of adding your family members to your care, sometimes this is not always feasible with face-to-face clinic appointments. When healthcare appointments are done virtually, you might be better able to have your family members be involved in your care. On a personal note, recently I attended a specialist appointment with my mother via video conference. We had scheduled the appointment at a time that was mutually agreeable to myself, my mother, and the specialist. And during the video call, I provided some of my concerns as a family member and asked questions related to the healthcare concern. The patient, or in this case, my mother, was also able to clearly articulate her concerns. And this was a particularly helpful discussion to have with all three of us, the patient, my mother, the medical specialist, and myself as family member, all receiving the same information at the same time. So this is certainly a benefit to having family members be involved in your care. Finally, virtual care can lead to more appropriate use of healthcare resources. Having routine checkups with your family doctors or specialists virtually may allow you to be more on top of your health concerns. This will hopefully translate to improved management of routine or longer lasting or chronic conditions, and assist with preventive healthcare. This means fewer unnecessary trips to the emergency room, longer wait times for minor health concerns. So those are some benefits of having therapy appointments or medical appointments done virtually. I will turn it over to Jacqueline right now to discuss some tips on how to best plan for and prepare for your virtual appointments. Go ahead, Jacqueline.
Thank you, Sucheta. So next we will go over some tips on how to get the most out of your virtual session. Getting the most out of your session is not only about the time you are spending with the practitioner, but also the time you spend preparing before and after your visit. So now let's go over some of the steps that you can take before, during, and after your visit. So before your appointment, some important steps you can take before your virtual visit are, first, check for emails from your healthcare provider. There may be some updates or helpful information about how to get set up for the virtual appointment. Next, it's a good idea to prepare a list of questions, symptoms, or concerns that you want to share. Often in the moment, we can forget things we wanted to discuss, and having a list will help to minimize this. Keep in mind, you may not get through your entire list, so prioritize 2 or 3 items that you want to cover during your appointment. Next, it's a good idea to make yourself available for 15 minutes before to about 30 minutes after your scheduled appointment in case there are any delays. This will keep you from feeling rushed or stressed during your appointment time. Next, if you're able, have a family member or a friend join. This can be a great resource to you. If someone will be joining your appointment, make sure that you go over the details of the appointment with them, confirming the exact date and time in advance. Next, I'm going to discuss some ways to make your environment more optimal for your virtual visit, as this can make a big difference to how you are able to communicate and participate in your appointment. So ideally, you want to find a private and well-lit space for your visit away from children, pets, and other distractions that might be in your environment. Try to avoid having bright lighting or an open window behind you. This causes too much light exposure and makes your image difficult to see on screen. If your healthcare provider will be evaluating your movement during your appointment, choose a room with extra space and minimal clutter so that you're going to be able to move around freely and safely. And try and have your device set up on a surface so that you can be hands-free. And finally, some considerations for the technology that you're using. You want to make sure that you have a computer, laptop, tablet, or smartphone with an internet connection. It's a good idea to decide what device you will use in advance and make sure that it is fully charged or plugged in. If you're using a tablet or a smartphone, you may need to download an app. Test out your technology, practice logging onto your device and onto the app the day before, and make sure that you have a strong connection. Check your audio and video and the sound and picture quality in advance as well. You'll want to keep your username and your password close by, near to where your device is. And it's a good idea to have your health card ready as well, as you might be asked to show it during your appointment. And if you're having any difficulty with setup, see if you can ask a family member or a friend to help you out. It can also be a good idea to use headphones or earphones during your session. This can provide greater privacy and may reduce sort of background noise and echo or any audio interference that can come up. So it's a good idea to have those ready as well. And again, just try and prop your device up against a stable object and sort of checking that your entire face and shoulders are visible. So on to the next slide where we're going to talk about during your appointment. So when it's time for your appointment, be aware that for video visits, you may have to wait for your healthcare provider to join. It's a good idea to get logged in and just wait at your device. For telephone visits, be aware that your health provider may call from an unknown or blocked number, so be sure to answer these calls. You can expect that your healthcare provider is going to confirm your identity and the exact location just for privacy and safety purposes. And again, you might be asked during your appointment to either show your health card or review the number. You'll want to have a phone and a pen and paper close by to take notes, or as Arjun did, a laptop or some technology that you like to use. Be sure to turn off your radio, your television, ringers on your phone, and any notifications or apps that might be interfering with the device that you're using. You'll also want to make sure that you have eyeglasses, hearing aids, walking aids, any equipment that you use regularly nearby during your session. And again, ask a trusted family member or friend to help you take notes if this is too difficult for you during your session or to do on your own. And for doctor's appointments, you're going to want to have your medications or a med list and your pharmacy information available. And remember, during your appointment, ask your questions and always start with the most important. So then after your appointment, it's a good idea to ask if recommendations or plans are going to be mailed or emailed to you. And you can certainly make this request if you're concerned that you might miss anything. Review and write down key information and ask if you can read it back to your doctor or therapist to be sure that you have everything correct. Give feedback to your health provider about the visit, about what went well and maybe what could be improved for your next virtual visit. And finally, if you're a UHN patient, you can also check your My UHN patient portal to access your reports, results, and appointment dates and details. You can share this information with other healthcare providers and trusted family members and friends. Now I'm going to turn it over to Karen, who's going to discuss when to access virtual care versus in-person care.
Okay, thank you, Jacqueline. Now that you have some ideas about how to prepare for and participate in a virtual visit, you might be wondering when a virtual appointment is an appropriate alternative to in-person care. I suspect that some of you may have already experienced a virtual health visit and know that they're being used now to address a wide range of health issues. When you call your doctor's office, an office assistant or a nurse will talk you through your issue on the phone. If your symptoms sound like an emergency, you may be advised to go straight to the emergency department of your nearest hospital, but otherwise you may be scheduled for a telephone or a video appointment. Virtual visits are an effective way to check in around new or ongoing physical or mental health issues. The Canadian Medical Association recommends that virtual care works quite well for the issues that are listed on these next two slides. So virtual visits can be used to evaluate changes in mood and mental health conditions, to address questions about minor illnesses, such as skin problems. You might be asked to take a photograph in advance. And for this purpose, photographs tend to work better than a video. If you have a sore throat, your doctor might arrange a throat swab. If you have eye irritation or redness with no change in your vision and no pain, they may be able to assess you virtually as well. Sexual health concerns, including screening and treatment of sexually transmitted infection, contraception, travel-related health concerns, and follow-up for conditions that are being monitored by a home device or regular blood work. Things like blood pressure, cholesterol, thyroid function, and different aspects of diabetes care. All of these could be potentially addressed virtually. In addition to these, we have review of lab work, medical imaging, your x-rays and ultrasounds, and specialist reports, consultations Those can be done by telephone or video. Over the last 6 months, Sucheta mentioned, we here at Toronto Rehab have been providing virtual neurological rehabilitations to many of our stroke and brain injury patients who've come home from hospital and require ongoing occupational therapy, physiotherapy, speech language therapy, and social work counseling. You can speak with a social worker, a psychologist, your psychiatrist, a registered dietitian. Many healthcare professionals are now providing virtual appointments. And virtual care can also be very effective for individual or group support and education to help you manage your chronic health condition. So you can see that virtual care can encompass many key health issues. Now, other health issues are going to require in-person care right from the start. And these include things like coughs. Your doctor will need to listen to your chest with a stethoscope. If you have abdominal pain or digestive problems, your doctor will likely need to examine your belly. If you experience ear pain, your doctor will need to look inside your ear. If you have severe muscle, joint, or bone injuries, you will need to be seen in person. And these symptoms might also require lab work or diagnostic tests, and in some cases, urgent or emergency care. And finally, if you have rehabilitation needs, physical or cognitive, that are complex, you'll likely need to be seen for in-person assessment and treatment. On this slide, any of the symptoms that you see here, they require urgent medical attention as soon as possible. You can call 911 or go to your nearest emergency department if you notice any chest pain, vision loss, shortness of breath, or weakness or numbness in any part of your body. Please remember, it is still safe to go to the hospital during the COVID-19 pandemic. We've reviewed a lot of information so far. If you're looking for additional resources about virtual healthcare, we have the following suggestions for you. The first one is a virtual care checklist. This is an initiative from the Canadian Stroke Best Practice Group from the Heart and Stroke Foundation. And to access this checklist, you can go to the link on your screen, or you can scan the code using your smartphone camera, and it will take you right to that page. The Ontario Telemedicine Network, or OTN as it's known for short, is a private and secure video conferencing service widely used by Ontario hospitals and health providers. Again, to access this website, you can go to the link on your screen or scan the code. On the UHN patient education website, you'll find all of the patient education brochures that have been created by UHN staff. We have a new virtual care page where you can find more resources about virtual visits, as well as guides on how to prepare for them. To access this page, again, you're going to go to the link on your screen or scan the code. And if you still can't find what you're looking for, we have trained health information specialists at the UHN Patient and Family Libraries who can help you find reliable and up-to-date health information. You can submit a health information request by emailing tgpen@uhn.ca. And that is all for me. I'd like to thank you for your attention and your attendance today, and I'm going to now turn things back over to Melissa. Thanks.
Thanks, Karen. So on behalf of our participants and the patient education program, thank you Arjun, Sucheta, Karen, and Jacqueline for sharing your expertise and experiences around virtual visits. I'm certain that the tips and strategies you have shared today will help all of us get the most out of our phone or video appointments with our healthcare providers. So now we'll check this Slido to see what questions have been submitted. You can still submit questions if you haven't already. To submit questions again, please go to slido.com and enter UHN Health Talk in the event code. You can also scan that code using your smartphone's camera or your QR code reader app, and it'll take you straight to the page. So just a few friendly reminders again, you can choose to include your name or stay anonymous, but please note that others will be able to see your name if you do include it. Again, please do not include any personal details about your health or your condition in your question. Our health talks are for general information only, and the speakers are not here to diagnose or provide treatment recommendations. And we'll try our best to answer as many questions as we can until about 1:55 p.m. And you can also vote for your favorite questions by clicking the thumbs up button, and this will bring the questions closer to the top. And I see here that we have quite a few questions already, which is really exciting. So starting from the top here, someone had asked, what strategies can you suggest to help clarify our personal goals and objectives? So this sounds like it could be a question for any of our speakers. Would any of you like to jump in and answer that one?
I'm wondering if Arjun would like to answer this first, and we can pop in after.
Awesome. Great question. I think so. Just to give everyone a background, mine was a very emergency situation. I was working normally, and then all of a sudden, my wife found me on the floor, and literally while I was in the hospital, I was just waiting to recover and get back to being normal. So for me, my goal and objective was getting back to the life I had before this incident happened to me. I can imagine the goal and objectives can be different for different people. For me, it was very simply to get back to being what I was, and try to just survive and provide for my wife as much as I can. I don't know if that helps, but that would be my 2 words about my objectives.
It's Jacqueline here. I think if I'll just jump in and add to that, Arjun, something that you mentioned in your presentation was getting feedback from your family around, what is it that maybe I could be trying to address, or I could, be working on. So sometimes that can be a helpful way to, sort of identify some of those personal goals and objectives.
Hi everyone, this is Sucheta here. In addition to what Arjun and Jacqueline have said, I've sometimes encouraged my patients who I work with to keep kind of a running log, a diary, a notebook, and a way, it could be new technology like a laptop, like Arjun suggested, a way to keep track of how things are going, what things are going well, what things have been challenging, their own goals and aspirations. And I think this sort of running log of one's account of how they're doing after their injury or illness, for example, or with ongoing medical concerns, can be a helpful tool in deciphering one's goals and objectives and how they're doing with that. Thank you.
Maybe I can just also add that I think it can be very helpful to consider your goals in a behavioral context. So what I mean by that is, what is it that you would like to be doing more or less of? And to put that in a SMART context, and we use this when we're helping patients with goal setting. So we use a framework. It's called the SMART framework, which stands for specific, measurable, achievable, relevant, and timely. And that can sometimes help to make your goal easier to work toward and to measure your progress.
Thank you, Karen, and thank you, Arjun, Sucheta, and Jacqueline for answering that one. So we'll move on to the next one now. So the next question, someone had asked, how private and secure are virtual visits with our healthcare providers?
Maybe I'll jump in and others can add. I think it's very important that you always ask questions. and confirm with your provider that they are using a secure and private network, video conferencing network with end-to-end encryption, and to ensure that video calls are not being recorded. So they happen in real time, and once it's done, it's over, and there's no footprint to that. Here at UHN, we are using OTN, Ontario Telemedicine Network, and MS Teams. These are the two platforms that have been approved for video conferencing for whenever discussion of personal health information is involved. Platforms such as Skype, FaceTime, WhatsApp, WebEx, Zoom, these have not been approved as meeting the standard for privacy and security.
Thank you, Karen. So for our next one, someone had asked, virtual visits mean using the technology to interact with patients or patient via internet services using smartphone, tablet, or computer. The point here is most of the senior or clients are not trained or educated to use such technology, or they may not have such resources. What are some ways to avoid that?
Go ahead, Jacqueline.
Okay, I think Sucheta and I both we probably all have some thoughts on this. So I think this is very much something that we have experienced with our quick turnaround to virtual therapy, recognizing that there's a population that maybe is not as comfortable with or familiar with using technology. And it certainly is a barrier in some of the therapeutic sessions that we have been trying to provide in our outpatient program. I think is some thoughts on how to avoid. Specific to our program here, we are trying our best to set clients up if they're, leaving the inpatient program and sort of reviewing the virtual therapy platform that we're using and trying to do some trial runs. So I guess any preparation or practice that can be offered to the individual in the community with maybe a family member or a friend who has some of this technology, if that's an option. And I would say the other way that we're trying to get around this is where we may use telephone, the phone as a way to provide therapy, which has some limitations as well. But I think we've all been able to find that we can have some fruitful sessions using the phone, which I think is something that many more individuals are comfortable with. I don't know, Sucheta, if you want to add some other thoughts there.
Yes, I think you've already hit on the idea of having a friend or family members helping out. And I think that this can either be an ongoing thing or an initial setup for family members to support their loved ones, often seniors, without this technology, if they're able to do some practice sessions with them in advance, to load those apps on their computers or tablets or smartphone devices in advance and test out the technology in advance. I'm going to bring up my mom here, who I know is watching this presentation today, and I'm so proud of her. She has really learned how to use this technology, not only for her medical appointments, but also some social, activities as well. So it can be done. It does take a little bit of effort from family members to support their loved ones with this technology. And when in doubt, I think the phone is certainly another option, like Jacqueline mentioned.
Thank you, Jacqueline and Sucheta.
I'll just add, Melissa, that certainly we are aware of the issues around equity and that not everyone has resources, not only the know-how, but also the resource to access equipment. And certainly we would not want that to be a barrier to treatment. So we certainly will consider that if we can offer in-person appointments in lieu of virtual for those who don't have access to technology. That's still an option.
For sure. Thank you so much. So going to our next question now, someone has asked, what happens if you don't have access to a smartphone, strong internet connection, or a tablet or laptops? What other options are there for virtual visits? Karen, I think you may have touched on this one just now. Would you like to summarize one more time?
Sure. So again, we want to make sure, bottom line, that people are able to access timely treatment and assessment. And so where possible, we would have someone come in for an in-person appointment and try to do some problem solving with them. And to see if there are any, friends or family members who might be able to assist. We have started to do some limited in-person therapy here, and so we would work closely with patients to try to come up with the best option for them.
Thank you. Yeah, it definitely sounds like talking to your healthcare provider and finding out what those options are would be the best way to go. Thank you. So going to our next question now. Someone has asked, treating certain conditions remotely can be challenging. How to come over this issue? So Karen, would you want to take this one? Because it sounds like it ties back to our part of our presentation about when in-person and virtual visits may be helpful.
I would say that is one of the challenges that we've come up against. Certainly, I think for some of our therapists, providing virtual assessment and treatment is extremely challenging. I'm thinking of physiotherapy colleagues, and certainly there are occasions for occupational therapy and speech as well. Sometimes, patients, it's very limited in terms of how much assessment can be done. Sometimes we need to be able to see patients in person to observe things like movement, transfers. Sometimes hands-on therapy is necessary. So again, where possible, if that issue does come up, then we may be suggesting an in-person appointment. We have several patients that we work with where they're doing a combination of virtual care and in-person care now, for that reason.
Thank you. Okay, so the next one has asked, we have 3 questions left, it seems. So this one is a 2-part question. The first one is using regular telephone for appointments with my healthcare provider considered a virtual visit? And the second part asks, what are the pros and cons of using telephone versus video for medical appointments? I may turn this one over to Sucheta because it sounds like this ties in with your part of the presentation today.
Yeah, sure. So yes, to the part 1, regular telephone is considered a virtual visit. And part 2, so yeah, there are some pros and cons to telephone versus video appointments. With a phone, no special equipment or Wi-Fi or internet technology is required. You just have your regular phone. That doesn't even need to be a smartphone. It can just be a regular landline phone. Generally low cost, and you can just use your basic home phone. Pros for the video conferencing sessions. So the ability to make the face-to-face connection with your provider would be there. They can observe you in real time, observe your symptoms, check out how you're walking or you're moving. They can look at different, conditions on your body if that's necessary. The ability to share resources and documents on the computer or on the tablet or whatever is definitely helpful for these video appointments, like on the screen. There are, of course, some cons to, I guess, either of these. Everyone's comfort with technology can vary, and so that might be a deterrent for using video conferencing technology. The internet and Wi-Fi may be unstable, and so some of these technical challenges, which we all have from time to time, may be there, and this could also be possible for audio and or video. As Karen mentioned in her set of slides, the need for hands-on assessment may be not doable with a telephone or a video based session. So I'm hoping that that answers some of that question around the pros and cons of using telephone versus video conferencing sessions.
Yeah, that was great. Thank you so much, Sujata. And so I'm just gonna go to the next one now. Someone said, oh, this is a question as well. So super good resources. I was just slow in getting to it. Can you please send those resources again? For sure. We'll if you email us at pfep@uhn.ca, I'll show that email address again later. We'll be sure to email you a list of those resources. And so finally, our last question here, and there's still time if you're still trying to submit a question, so you definitely, please feel free to do that. Someone has said, I've tried some virtual care ranging from support groups, including individual physicians. Can you tell me what's missing though, since I need to find a balance in my life and the pandemic will continue for a while, but I'm not sure what's missing. I can't describe the palpable missing quality. So I guess this question also goes back to getting the most of those appointments. So if there are certain tips related to support groups or even one-on-one consults that you have all found were helpful, we could summarize those again, perhaps.
I'll take a stab at some of this, and maybe my colleagues and Arjun, you can jump in. I think it's been a hard transition for everybody, and also speaking from the practitioner side, it's been hard as well. So going back to some of the tips to getting the most out of your sessions. Hopefully feeling comfortable maybe to give that feedback, either directly to your healthcare practitioner or your support group members, or maybe doing it privately if you have questions that sort of follow your sessions. I think that probably the comment about what's missing, I think we're all missing maybe that sort of familiar in-person, more personal contact that we've all been very used to in either receiving therapy or providing therapy, and in providing virtual therapy over these months. I can certainly say that it takes time to, and it may be in a different amount of time to sort of build the rapport with the person across the screen from you. And it can feel a little bit different for those first initial sessions in certain cases. I'm going to sort of open it up to the rest of the panel to see if there's any other thoughts around this comment and question.
I can take a stab if it's okay with the team. I honestly think, I think it was Jacqueline or Sucheta who mentioned that you can bring in family members for these virtual care appointments. And for me, initially, my wife joined in all the calls. She would also be taking notes with me because she loves writing down everything she's listening to. And then she'll keep pestering me that, Arjun, you need to do this homework, you need to do that. So the one good thing with having everything virtual is that the therapists and the healthcare providers are now more flexible in terms of having your family members join you in any of these calls or any of these virtual connects. So maybe that would be the missing quality, my recommendation.
I would just add that I do agree with the person who has submitted this comment. I think we all know that, communicating and experiencing each other across technology is very different from the immediacy of being in the same room or across the table from one another. And so it is different, and I think we've all learned that we have to adjust and maybe shift some of our expectations, and finding balance in your life. I think that's crucial. So what you may not be able to get in this kind of interaction, to be sure that you do have the opportunity for some in-person communication with other people in your life, so that you don't feel like you are now living solely through your device. I think that's really important.
And perhaps one additional thing is just in finding that balance in your life when you're doing a lot of your appointments and sometimes even social visits on a computer or a tablet, is to block off and schedule times when you're not engaging in the technology at all. You're doing a reading with an actual book, or spending time doing some gentle exercises, or going for walks and enjoying nature. So these are some ways to engage yourself in other parts of your life that you've normally enjoyed, but maybe some of those are taken away from us now because of the COVID situation. So being mindful of how we spend our time. I know a lot of it is going to be spent perhaps more so on a computer or in a device mode and engaging in therapies or appointments. But if we can continue to strive for different activities that we can do without the technology, that would still be wonderful.
Thank you, everyone. I totally agree with you, Sucheta. It's really helpful to be able to turn off a computer or a device and recharge for a little bit. Thank you. So awesome. So it looks like those are all the questions we have received. So I just wanted to thank you all again for attending today's session and submitting those questions, those great questions. If you didn't get a chance to answer, or if you didn't get a chance to ask a question or a question comes to mind afterwards, please email us at pfep@uhn.ca and we'll try to respond within 1 week. Your feedback is very important to us, so please go to the link on your screen and complete the survey. Or again, you can scan the code using your smartphone's camera or QR code reader app, and it will take you straight to the survey. Since this is our first virtual session, we'd love to get your feedback to find out what went well and what are some things you would like to see next time. And finally, to find out about our next talk, please subscribe to our MailChimp online newsletter, and you'll get up-to-date information about our events and even new resources at UHN. And to fill out a form to subscribe, you can go to the link on your screen, or again, scan the code to get to that form. But yeah, thank you everybody for attending.